Hey everyone! If you've ever stared at a massive pathology textbook and just wondered, how am I supposed to master this for my exams? Well, you are in exactly the right place. Today, we're going to build a really powerful framework that'll help you tackle any topic, whether it's inflammation or neoplasia, and deliver that perfect answer when it really counts. So let's jump right in.
I mean, we've all been there, right? You've read the chapter, you've made the notes, but then the professor points at you and asks you to summarize a super complex disease. How in the world do you boil all of that down into a clear, confident 2-minute response? That is the exact problem we are going to solve today.
All right, so first things first, we need a fundamental shift in how we approach this. Success in pathology. It's just not about rote memorization. It's about moving past just knowing the facts to truly, deeply understanding the why and the how behind a disease.
And here is the absolute key. Examiners aren't just testing your memory, they're testing your thought process. They want to see that you can connect the dots, that you can trace the whole story of a disease, from what started it, to how the cells changed, to what it looks like under the microscope, and ultimately what it means for the patient.
So to bridge that gap between just knowing stuff and actually reasoning through it, we need a system, a reliable structure that you can apply to any topic you come across. And that, my friends, is what this 5-step framework is all about.
So here it is, our roadmap in 5 simple steps. We're going to start with the basics, the definition. Then we dive into the why. That's the pathogenesis. Next up is the what. What does it actually look like? That's morphology. After that, we figure out the how, our diagnostic reasoning. And then, the grand finale, we pull it all together into the perfect exam summary.
To really see this framework in action, we're going to apply it to one of the most important, high-yield topics in all of pathology, neoplasia. So let's kick things off with steps 1 and 2, the introduction and the pathogenesis. Step 1, the introduction. You always want to start with a crisp, clear definition. For neoplasm, it sounds just like this. A neoplasm is an abnormal mass of tissue with excessive, uncoordinated growth that persists even after the initial stimulus is gone. See? It's simple, it's precise, and it's the perfect way to start your answer. Now for step 2, the why. At its core, carcinogenesis is all about genetic mutations. The best way to think about it is like a car's controls going totally haywire. You've got proto-oncogenes, those are the accelerators, and they get stuck on go. Then you have the tumor suppressor genes, the brakes, and they just fail completely. Then the genes that regulate programmed cell death get switched off, so cells basically become immortal. And to top it all off, the DNA repair crew gets knocked out, which lets even more mutations pile up. It's a total mess. So what's causing all these mutations? Well, the triggers, what we call carcinogens, they usually fall into 3 main buckets. You've got chemical ones, like tobacco smoke. You have physical ones, like UV radiation from the sun. And you have microbial agents, like the HPV virus causing cervical cancer or H. pylori bacteria, which can lead to stomach cancer. Okay, so we've covered the why. Now let's move on to step 3, morphology, and see how this all starts to come together. This is where we put on our pathologist hat and actually look at the tissue itself. You know, when a biopsy slide lands on the microscope stage, this is the single most important question we have to answer. Everything else, the entire diagnosis and the whole treatment plan, it all flows from this one fundamental distinction. This table is awesome because it lays out the key differences so clearly. Benign tumors, they're well differentiated, which just means they still look a lot like the tissue they came from. Malignant tumors, on the other hand, show anaplesia. That's a total loss of that normal structure. And just look at the nuclei. Benign cells are all uniform and small. Malignant cells are pleomorphic and hyperchromatic. That means they're a chaotic mix of different sizes with really dark nuclei. And, of course, the defining difference, metastasis. Benign tumors stay put. Malignant tumors have the terrifying potential to spread. So how do we make that critical call? Well, we hunt for very specific clues under the microscope. Let's take a look at the classic cytologic hallmarks of malignancy. These are the features you absolutely have to burn into your brain. The nucleus gets way too big for the cell. The border around the nucleus becomes jagged and irregular. The chromatin inside stains super dark. That's hyperchromasia. You see these prominent nucleoli, lots of weird-looking cell division, and most importantly, you actually see the tumor cells invading into the healthy tissue around them. Now, trying to remember all that under pressure is tough. So here's a fantastic mnemonic to help you out. Plain mess. It stands for pleomorphism, loss of differentiation, atypical mitosis, infiltrative growth, nuclear hyperchromasia, metastasis potential, elevated mitotic rate, and structural disorganization. It's a really handy tool for quick recall.
Okay, let's move on to step 4, diagnostic reasoning. This is such a brilliant example of how molecular pathology changes everything. You see, in non-small cell lung cancer, we don't just say, it's cancer. We ask, who is the patient? An older smoker is way more likely to have a KRAS mutation, but a younger person who's never smoked, they're more likely to have an EGFR or ALK mutation. And this isn't just academic. It completely dictates their treatment. The patient with the ALK mutation might have an incredible response to a targeted drug like crizotinib, while the KRAS patient won't. This is modern pathology in action.
All right, let's quickly clear up two terms that get confused all the time: grading and staging. Grading is what the pathologist does at the microscope. It's all about how ugly the cells look, which tells us how aggressive the tumor is. Staging, on the other hand, is a clinical assessment, usually with imaging, that tells us how far the cancer is spread. So just remember, grade is about appearance, stage is about spread.
And the universal system for staging is the TNM system. T stands for the primary tumor's size and how far it's invaded locally. N is for nodal involvement, has it spread to nearby lymph nodes. And M is for metastases. Are there any spots in distant sites? The TNM stage is one of the most powerful predictors of a patient's prognosis, period.
Okay, we've gone through the definition, the pathogenesis, the morphology, and the reasoning. Now for step 5, the most important part for your exam, putting it all together into that perfect, concise summary.
So, when that examiner looks at you and says, summarize neoplasia, here's what your 2-minute model answer sounds like, putting everything we've talked about together. Neoplasia is abnormal tissue growth that's uncontrolled and persists. Malignant neoplasms are distinguished from benign ones by their anaplasia, their high mitotic rate, and their potential to invade and metastasize. Carcinogenesis is a multi-step process that involves mutations in key genes like TP53 and KRAS, and it's often driven by carcinogens. The diagnosis relies on identifying cytologic hallmarks like pleomorphism and hyperchromasia, while staging with the TNM system is what determines the extent of spread and helps guide treatment.
So there you have it, a structured, repeatable framework you can use to deconstruct any topic in pathology and build the perfect exam answer. You can apply this exact same 5-step process to inflammation, to amyloidosis, to any carcinoma you can think of. The most important thing is to move beyond just memorizing and to start thinking like a pathologist. So, my question to you is, what topic are you going to master next?